Okay. Hi, everyone. Good afternoon to you. Good evening, good morning across the world. Welcome to today's very important webinar. The webinar is co-hosted by the Planetary Health Alliance West Africa and the Climate Action Accelerator. My name is Mary Aram Achinyo. I am the founding representative at the West Africa Hub of the Planetary Health Alliance, and I am super excited to be your moderator for today. Today's webinar is themed From Knowledge to Action, Climate and Health Partnerships in West Africa. And why we thought that this would be a very important topic is the fact that our two organizations have been implementing climate activities within the West Africa region. As you already know, climate change continues to pose growing threats to health systems, particularly in very vulnerable populations such as West Africa. Strengthening partnerships between climate and health actors is therefore very critical to building resilient, low-carbon development pathways that will protect health and the human health and planetary health. So today we are looking forward to a very exciting session. We have three amazing panelists. They are going to be telling us about the work that we do in our two organizations. Specifically, we would have a first presentation by Paul from the Planetary Health Alliance West Africa. He will be telling us about the areas of work of the Planetary Health Alliance across West Africa. And that presentation would be followed by a presentation from Alexandre from the Climate Action Accelerator. He's going to be talking about climate action in the health sector within West Africa. The third presentation would be made by our colleague from the Climate Action Accelerator, Saninka. She will be talking about CAA's collective cycle in West Africa. And then we would have our colleague Hannah from the Planetary Health Alliance, the global team, to give us her reflection on the three presentations. And then we'll take your questions and answers. So without taking much time, we would like to take the first presentation from Paul, who will be talking about the activities of the Planetary Health Alliance within the West Africa space. Thank you. Paul, are you ready? If you are ready, please get ready for your presentation. Colleagues, all the rules for virtual meetings do apply, and I'm sure we have been having Zoom meetings for 5 years now. So we are not going to repeat them for the sake of time, but please make sure you are muted when you are not speaking so that we can clearly hear the presenters when they speak. Thank you, and over to you, Paul.
All right. Good. It's an honor to share our work with you all today. My name is Oluwaseun Paul Amo, the project lead for Planetary Health Alliance West African region. So permit me to start with a quick question. How many of you felt the impact of climate change in your communities, whether through rising temperatures, unpredictable rains, or health challenges? This is why we are here, because climate change is not just a distant threat, it's reshaping lives now, especially in West Africa. And here's the good news. Together, we are turning knowledge into action. And today, I'll be walking us through the journey so far, what we've been able to accomplish, and what we've learned, and most importantly, how we can work together to shape a healthier, greener, and more equitable West Africa. Next slide. Our region was commissioned in 2019, and it has grown into a dynamic force, the region. But leading that force is someone we all admire, our regional representative, Dr. Mary Achinyo. She's not just a physician specialist in public health. She's the compass that keeps our planetary health ship steady Dr. Mary, we salute your tireless efforts, your visionary leadership, and for always reminding us with a smile on your face that saving the planet is a serious work. Our region spanned 16 dynamic West African countries. We have countries from Senegal, Sierra Leone, Ghana, Gambia, Nigeria, Niger, and many others. This wide coverage brings diverse ecosystems, challenges, and opportunities. But most importantly, it gives us an unmatched strength in diversity. And when we act together as a region, we act with power. Our vision is very clear: to have a resilient West Africa where human health and environmental sustainability coexist harmoniously. And our mission is to advance innovative solutions and promote holistic approaches that safeguard human well-being while preserving the ecological integrity of the region. Next slide. To achieve this, our region focuses on pressing challenges like forestation, food insecurity, pollution, and climate impact. We also focus on forging partnerships with governments, local communities, and institutions. And our focus is on conducting collaborative research, integrating environment and health, producing real-world solutions. So these are not siloed activities. They are part of the living system of action. We believe strongly that when research meets partnership, impact happens. Next slide. Climate change is no longer coming. It's here already. And, just the way Dr. Mary started this webinar, you can see that it's really hitting us in West Africa, because we have seen more heat waves, we have seen droughts, we have seen vector-borne diseases, and our response is adaptation and mitigation from our region, because we always support sustainable agriculture, water sanitation projects, community-led adaptation initiatives. So it's not just about, surviving climate change. It's about helping communities thrive despite it. Next slide. Air pollution is a silent but deadly threat. And in West Africa, it stems from, vehicle exhaust, biomass burning, industrial emissions. And, right now we are pushing for cleaner energy solutions. We are pushing for smarter urban transportation. We are pushing for green industry practices. And the reason is because planetary health promotes clean air for every breath, not just for the privileged few, but for all. Next slide. In terms of capacity building and community empowerment, we know very strongly that lasting change doesn't come from outsiders. It grows within. And our focus is on community engagement in projects from design to implementation. We also focus on capacity building through training and education. Our focus is on knowledge sharing to enable the widespread dissemination of local innovations. Our focus is also on leadership development, grooming from local champions, grooming local champions of planetary health. And this is how we are creating the movement, not just a moment. Next slide. When you talk about youth engagement, youth engagement is one of our most inspiring successes. For instance, we have campus ambassadors across the continent, those who are building awareness and taking action. And we're always very available to provide mentorship and training for emerging leaders. We are always open to intergenerational collaboration, paying our youth with experts. And why are we doing this? We are doing this because we believe that young people are not just the future. They are the present voice of change. And we are proud to be a launchpad for their voices. Next slide. For policy advocacy, we believe strongly in our region that without policy change, progress stalls. And thereby, we advocate for climate mitigation laws. We advocate for biodiversity conservation, advocate for health equity and environmental justice. Currently, we are working with government to ensure decisions are evidence-based, they are people-centered, and of course, planet-focused. And this is where science meets governance so that impact can scale. Next slide. In our region, we believe strongly in education because we believe that education is the gateway. We organize and attend seminars, webinars, and conferences across the region. We raise awareness in schools, universities, and of course, even in the community. We inspire new generation of planetary health champions. And the reason why we focus on health education is because when people know better, they do better for themselves. And of course, their health as well. And in the long run, their environment. Next slide. Some of our lessons that we've learned in the region. So what have you learned? I've learned that partnership amplifies progress. We have learned that youth are a driving force. We have learned that cross-sector collaboration is very essential. We have learned that policy influence takes persistence, and at the long run, it pays off. And what are our future plans that we have in the region? We plan to expand partnerships with other regions, hubs, and sectors. We have some other regions that we've been working together, and we plan to do more. Our future plan is to also strengthen national and regional advocacy because we believe so much that there's this gap in knowledge about planetary health. And that is why we plan to strengthen national and regional advocacy. We also plan to bring in private sector as change agents. And, with all of these put together, we believe strongly that we can't do this alone. We need you. We need your ideas. We need your networks. We need your passion so that we can make this region the heartbeat of West Africa planetary health. Next slide. As we draw this conclusion to a close, as we draw this presentation to a close, pardon me, I want us to leave with a clear and compelling message. The West African region of the Planetary Health Alliance is more than just a network of projects or professionals. It is a movement of hope, action, and transformation. Through our initiatives, we have observed that when science is localized, communities are empowered, and sectors collaborate through impact or cause. We've learned that planetary health is not an isolated ideal. It is central to our survival and well-being. And we've also learned that local communities are not beneficiaries. They are partners and leaders. We've learned that our youth are not waiting for the future. They are already shaping it. We've also learned that policy is not just a paper. It's a powerful tool for systemic long-term change. And if we truly want to build a resilient West Africa, where human and environmental health coexist in harmony. We must learn to strengthen cross-border collaboration. We must learn to share local innovations and build solidarity across disciplines, across generations and geographies. This is our moment to scale up our impact. So to all NGOs, to all researchers, to all youth leaders, to all health professionals, to all policymakers and development partners, we need you. We want to work with you. We want to connect with you. We want to cooperate as we catalyze solutions together so that we can all turn our region into a continental force for change, a model for action, and a legacy of health for our children and grandchildren. Together, I want to advise that we should go beyond awareness. Let's move from knowledge to action. Let's lead the charge for planetary health in West Africa and beyond. Thank you for your attention, your presence, and most importantly, your commitment. Let's build the future together. Thank you. Over.
Okay. Thank you so much, Paul. That was a very wonderful presentation. And thank you for emphasizing the work of the Planetary Health Alliance in West Africa across capacity building, policy advocacy, research, education, and governance. And thank you for emphasizing that partnerships are the pathway for moving from knowledge to action. And you have said that it is extremely important for us to map out our stakeholders for partnerships. And these stakeholders should include governments, non-governments, both national and local. And then more importantly, the youth are a very strong force to advance the planetary health agenda within the West Africa region. And I was very happy when you said that the youth are and we wait for tomorrow and tomorrow never comes. And before you realize we are no longer youth. So that was a very good advocacy. Thank you so very much. And you also talked about the Campus Ambassador Program of the Planetary Health Alliance. And I know many people often ask for opportunities. And this is one of our flagship programs for young people to be able to apply and get selected for each year. And I like the fact that you also mentioned that our partnership needs to be cross-sector. It needs to be across geographies, across countries. And that is the only way that we would be able to reach everyone who needs to take action for climate and health. So thank you very much, Paul. I have the pleasure to call on our next panelist. Our next presentation would be on Climate Action Accelerators, Climate Action in the Health Sector. So don't get it mixed up because the name is similar to the presentation, the theme. And this presentation will be done by Alexandre from the Climate Action Accelerator. Alexandre, please, over to you.
Thank you. I was sharing my presentation. I think it will come now. Let me share in Panorama. So thank you very much, Mary, for the introduction. Sorry, slideshow. Okay, now it works. Yeah, I'll introduce myself a little bit and reflect on a few things that Paul presented before I jump into my presentation. So Marie introduced me already. Just to say a few words, I'm a nurse by background, so I worked in healthcare. West Africa is very close to my heart because I worked about 4 years during the Ebola response in Senegal, Mali, and Guinea about 10 years ago. And in the past 5-7 years, I've been working hard on promoting planetary health within the Planetary Health Alliance, but also by co-founding 2 NGOs named Alliance Santé Planétaire in France and Switzerland. And I'm very active in the Europe hub for planetary health here. And yeah, thank you, Paul. I really like how you push forward the need for the approach of planetary health, how we can build a movement in West Africa, maybe to do things differently, because that's what is planetary health is about, and that's why we have a new approach and a new concept. Yeah, we decided to do this webinar together with this spirit of collaboration. And I really agree about the strong need to build local leadership, as you said. So thank you for your presentation on planetary health. My presentation will be a bit more operational because at the Climate Action Accelerator, we think that people change and thrive in action. So our model is more in implementation and operation. At some point, I will give an example of cross-sectoral collaboration that you mentioned, Paul. And it's not all about West Africa. We're more presenting what is relevant to West Africa, though we have a project in West Africa and one in Chad, around the Lake Chad, which is at the border of West Africa to Central Africa. So I'll go through a small overview of our strategy, then focus on two of our projects. And at the end, I'll give a few words about what we propose in capacity development and amplification. So the focus of our strategy in 2025 is really that we want to try to demonstrate our impact and consolidate our reputation in the sector. Here is our operating model for health. So we call it an acceleration model. We want action to be implemented faster. And how we do that, in the center, we have the implementation of pilot projects to integrate resilience and sustainability in a health facility. I'm moving a bit this, okay, yeah. And we do that always while improving population health. And we have programs that are transversal, more at a health facility level, and we are currently developing vertical programs, but I won't talk about that today. And then from these pilot projects, we can extract some learnings and build capacities of health actors and health agencies through some knowledge transfer and mentoring actions. All the tools and resources we develop are open access, shared as a common good, and we base our work on tools endorsed by WHO. And we think that when we have actions through pilot projects that people can build their capacity, we can also act on amplifying the change and disseminating these tools, these experiences, and also try to influence systemic actors and ministries of health so they can integrate climate action or planetary health action in their plans. Now the pilot projects. So I'll present a bit an introduction and then a focus on these two projects, the CRESH Nguri in Chad and Seneya in Senegal. CRESH stands for Climate Resilient and Environmentally Sustainable Healthcare or Hospitals or Health Systems. That's the designation you can find on WHO guidance online. So our CRESH pilots, they're based on WHO guidance. You have an example on the photo on the left. And how we do this is that in our projects, through a tool called vulnerability and capacity assessment, we help health facilities to develop a climate action or an adaptation plan so they can adapt to their climate realities. Then we support them to implement climate smart or low carbon actions to both build resilience and reduce the environmental impact. And yeah, the impact we want to have is to shift to low carbon models that can meet the health needs related to climate change. So these are our 4 running CRESH pilots. There is one that I will present in Nguri in Chad. The specificity here is that it's a secondary hospital in the Lake Chad region, so with issues around desertification and change of patterns in water. We also work on the primary healthcare network in South Africa. So there the specificity is more the primary healthcare level, and the level of resources is a bit higher. We're more in a middle income country here. The third one that we started end of last year is in Bangladesh, in Cox's Bazar, which is the biggest refugee camp in the world. And the specificity here is to work in a refugee camp that is in a coastal area. So the climate reality is a bit different too. And last but not least, I will present it a bit after the Seneya project with Soltis in Senegal. There it's also primary healthcare centers, but the focus is broader with a One Health approach. So the crash in Gouri in Chad is implemented with our partners Alima and Alert Santé, and under the leadership of the local Ministry of Health and Health District. There, what we've seen is an increase of food insecurity and changes in infectious disease epidemiology. I won't enter into details, but linked to increased temperatures and change of the water cycle locally. What we've seen in our assessments is that there are now malaria peaks that are much bigger than 5 to 10 years ago. The hospital struggles to deal with them, especially in the context of regular loss of electricity and oxygen. So our plan there focuses on having a resilient energy and oxygen infrastructure to provide oxygen to children with anemia that have malaria, for example. Community interventions also on malaria. And one key activity that came up, and we didn't expect that, is to have a blood bank to be able to have transfusions of kids and finally work on disaster management. And we've just done an interim evaluation in March 2025. The results are not ready, so I won't share it now, but I can answer some questions at the end. Another project is a One Health project called Seneya in Senegal. It's led by Soltis in partnership with also a local NGO called Green Sedu and an international NGO called Agronomes and Vétérinaires Sans Frontières. There we want to both strengthen community and health service resilience. You can see the multi-sectoral collaborations across the One Health disciplines. So Soltis is working more, let's say, on public health and health, human health. Agronomes Vétérinaires Sans Frontières will work more on the animal health component. The local NGO Green Sedu more on the ecosystems health, and we are in charge of more the climate resilience of the health facilities. In concrete terms, you can see that as a local concrete planetary health project for the community and the health facilities. And we're just starting. We just led the vulnerability and capacity assessment. I'll come back to that. And these two projects are led by my colleague, Mohamed Junku, that is not here because he's at the moment in the field in Sedu where this project is being implemented. So from these pilots, we tried to build tools, have some capacity building projects such as a Climate Transformation Academy. And I'll mention another project which is more on the capacity development level. So for the moment, our main tool, and we can share that after this webinar or in the chat, is our health service level climate vulnerability and capacity assessment. This is a comprehensive tool or guide with mixed method. We analyze the facilities quantitatively, and we do also scenario-based focus group discussions with the facility leaders, with the healthcare professionals and representatives of the community. So together we can generate a prioritized and implementable health facility adaptation plan, such as the example I gave in Gouri, Chad. So this is published online. And what we're working on at the moment is a toolkit on monitoring and evaluation. And with the view of trying to work also on cost impact modeling. And at the moment, we have a repository of monitoring or process and performance indicators that we provide to our partners. How does it work? When they identify some climate solutions, such as training the staff, dealing better with malaria peaks, etc., they can find the right indicators, how to measure them in this repository that we provide them. In South Africa, we have another pilot project more on capacity development, where we are about to publish a toolbox of all tools useful for transforming healthcare systems and services into climate resilient and low carbon models. So we're going to communicate on that soon. And we develop an operational methodology to support and collaborate with our partners in South Africa, such as the Western Cape Department of Health or National Department of Health. And the target audience of the toolbox is either health system management teams or hospital directors. I'm going to show you 2 screenshots of the toolbox mockup for the moment. So that will be a tool where you can look for tools, decide on the focus, either facility or system level, where in the project cycle phase you are. Some systems and facilities, sometimes they already have a plan, they already have a planned finance, and they're in the implementation phase, so they can target implementation phase. Others are just started, they want to assess their carbon footprint, and they can tick this different box. And under categories, you have all the domains of actions, such as energy, infrastructure, medical practices. It's a long list of examples, but just to give you a few. And once you've searched some results, you'll have here a list of results, and you can refine the results. So this will be published, I think, in June. Please follow up on our newsletter or social media to stay in touch with this news coming. And how we've designed that toolbox, we've taken some user cases, such as a hospital director that wants to understand the health facility vulnerabilities and capacities. And for example, it will search, as you can see to the right, and end up on a carbon footprint questionnaire or a tool on vulnerabilities, or our own toolkit on climate vulnerability and capacity assessment. And another case could be someone, for example, as a Ministry of Health, they already have a plan. They want to look for funding opportunities to implement that action plan, or for some thematic operational tools. And by searching this way, they will find, for example, the Green Climate Fund or some resources on energy or others. And I will finish on our amplification components and initiatives, just to mention that all what we do, we try to co-design and communicate about it in webinars or workshops in the future of hospitals and health systems. The goal of this initiative is to ensure fit for future hospitals and health systems in low resources or vulnerable settings, such as many in West Africa. And we co-lead a working group on low carbon, resilient and sustainable healthcare models with the Geneva Sustainability Center, which is part of the International Hospital Federation, which is the biggest federation of hospitals in the world, of 75,000 hospitals, more or less. And outside of this, we work with WHO Alliance for Transformative Action and on Climate and Health to align everything that we do, or even share some knowledge with them. And I thank you very much, and I will be very happy to take your questions later. Thank you.
Thank you very much, Alexandre, for the very exciting presentation. This is very, very insightful. I liked the model, the acceleration model, which you presented. And I like how you start from the pilot to capacity building and amplification, and how you are supporting communities and hospitals with the tools that they need to develop adaptation plans and also implement them. And I was particularly excited to hear how you are involving hospital managers and directors and clinicians. Because usually when we talk about climate action, the public health people get interested, but then the clinicians usually want more insight about how they can connect their clinical intervention into with the climate action. So this is really, really exciting. And I'm already thinking that our colleagues in the Doctors for Planetary Health will be very excited to learn more from you. So we have a lot of partnerships to be able to learn from the acceleration model. So thank you so very much. Great. So colleagues, I'm going to invite our third presenter. And our third presenter is Zaninka from the Climate Action Accelerator, and she will be talking about the collective cycle in West Africa. Zaninka, do we have you online, please?
Yes, you do. Can you hear me?
Yes, please. Yes, please. We can hear you. Over to you, please.
Yes, let me share my screen. Hopefully the system lets me. 1 second. Yes. So if you can let me know just quickly with the sound that you can see my screen. Yes.
Yes, it's perfect.
Yes,
please go ahead.
Super. So yes, my name is Zaninka Nagwinjira. I'm also a colleague from the Climate Action Accelerator. I work specifically in the program team, so kind of more with organization. So as Alexandre was talking about, kind of the project that we're specifically doing with different actors, most specifically piloting, I work more with kind of working on organizational transformation with our partners. And here I'll be talking about the program that we've kind of developed specifically for our local and national partners that started from the work that we started with Alima, one of our first partners, and that developed into helping Alima's national actors. And then we realized that there was an interest there with local and national actors, especially in West Africa, that wanted to do this work themselves, especially because, as Alexandre mentioned, I think during the introduction on the accelerator, the idea is to create more and more domino effects by letting people talk about it and more people talk about it with their networks. And that's how you end up with kind of a critical mass of organizations and actors that are doing this work. So that's kind of what I'm going to be focusing on, is our collective cycles in Africa. I will skip over this, I think, the introduction of the accelerator, as I think we covered it, and then go specifically on the partnerships that we have with these organizations. Here is just all the partners that we have, and specifically today the 13 that we have based around West Africa and the Sahel. The first collective cycle that we did in 2023 was with 5 NGOs. It's the first 5 that you see here that are based in Burkina Faso, in Mali, in Chad, and in Niger. And then in 2024, we started a second one that was with 8 organizations, mostly based in Senegal, with 1 based in Cameroon. And the idea is to really we asked ourselves, how can we tailor the program that we have on decarbonization and mitigation with international organizations to really be about low carbon development and resilient development for national actors that are interested in mitigation, are interested in climate action, but because they have smaller footprints, are also interested in thinking about how they can evolve and grow as an organization, but decoupling that from their emissions, but especially thinking about the resilience of their different programs, whether that's health. A lot of the organizations we worked with in the first cycle were very health oriented, and then in the second we kind of evolved into youth, into development, into a lot of different sectors around civil society in general in West Africa. So we really adapted what we did to reflect more what our partners did, and we also organically let the focus and what that means specifically to be based on what our partners think. And like I mentioned, really the organizations that we work with are in different sectors and in different scope of activities that can be summarized, I think, in maybe the word aid as a really big word, or the word solidarity. So we have a lot that are in health, that are working on very specific health issues, that are working in very specific health issues in health or in different contexts, in specific contexts like prisons or for displaced persons that are working on education, on training, on inclusion, on conflict prevention, but that all shared the fact that they have witnessed climate change, witnessed climate deregulation and environmental pollution, and want to do something about it themselves, right? And say that no matter what our work is, specifically what our mission is, we see a link with that, with the environment, and we want to play our part. So we partner with these organizations. We have shared objectives and an approach that we decide together and that we work on, that is kind of made of multiple different things, and that is made up of different objectives that each of the partner bring to the partnership. But in general, what that looks like is that we work on an adapted roadmap. So it's the roadmaps that we will be able to share as well after the webinar that all our partners have made of. It's an adaptation of that includes climate adaptation and resilience. So each of our partners in the collective cycle ends up with their own roadmap. So we work on it together, but they end up with their own roadmap that looks like each organization. We do work on measuring, so we measure their carbon emissions and their waste, but in a more simplified way. So we collect data, we analyze, and we show them specific insights on where their carbon emissions are coming from, where their waste is coming from, so to understand better what we can work on. We work a lot on reinforcing and accelerating the projects that they have already in place. As I'll be able to show a bit after, is they're already working on many things. They have already noticed in the different work that they do, the link between climate and their specific work, the link between climate and youth displacement, the link between climate and education. So they're already doing something. So how do you accelerate that? How do you capture the things that they're doing and put it in a document that they can share? How do those activities not go kind of invisible or go unseen? How can we work on highlighting these projects and maybe giving them better access to climate funding and health funds by writing it down, by capturing it, by noting it in case studies? So we work a lot on that. And then in a generous sense, as we do with all our partners in the accelerator, we work on influencing their peers. If we're partners with the climate action, with the 5 first partners that were Alima's partners, is because Alima influenced its peers. The second cycle, it's because some of those partners in the first cycle talked about it with their different networks, and we were able to gather new networks that those organizations were able to join. The partner from Cameroon that is in this second collective cycle, the only one that is not from Senegal, it's because it's part of Alima. So it was the additional partner of Alima that also wanted to do this work. So this idea of influencing your peers and your network towards a more collective low carbon transition is really important. And it's a role that they play very seriously, because there's a lot of mimetism and they want to know what others are doing, and then making sure that everything that we do, everything that they do is shared with a global community of partners. So our partners, the partners in this webinar, so making sure that what they do is also visible in a different scale and with other organizations and other. And we have a methodology that is adapted depending on the size of the partners, but really it's about understanding the organization through data collection, through state of affairs, choosing what the thematic priorities are for that cycle. So obviously the thematic priorities perhaps with the first cycle that had more health organization might be different than with a cycle that has more educational or development actions. And then working on building the roadmap, the content of that roadmap, talking about how to deploy them. So talking about finance, talking about implementation, and then sharing that roadmap and publishing it and having a webinar, and then helping them through implementation with different priorities and monitoring frameworks. So this is, again, it looks very similar to our methodology that we have with our partners in any case, but adapting it to kind of grouped organizations together. I think what's interesting is to also talk about concrete examples of projects. Here you have just a few, and I'll talk specifically about 2 from our first collective cycle, because the second one is currently being built. But you see, for example, ONG Concept on the left side and Caceres. These are projects that they already put in place even before joining the accelerator. So how do we make sure to include that in the roadmap, share, and kind of bring it to a different platform? But specifically, Alerte Santé and SOS Médecins, these are projects that they implemented through the roadmap. Alerte Santé, which Alexandre also mentioned, that is working on the Guru project, through the roadmap, developed a project where in partnership with multiple community radio stations, is able to disseminate weather and climate data, especially with how it links to health, to different communities in different languages, so that people can know this information. Because they noticed that, at least in Chad, a lot of the climate bulletins that were published by the National Meteorological Information Agency was only in French, and that people sometimes needed this information to know whether or not this was going to have an impact on not only their agricultural activities, but any health indication. So they started working with this national agency community radio stations to diffuse this information in local languages, also because people listen to the radio more, might not be all literate. So this is a very interesting specific example that made sense for Alerte Santé. For SOS Médecins, they work in health clinics inside of prisons or kind of youth reintegration centers, and they noticed that there was a lot of open spaces and green spaces in these prisons or these kind of detention centers that were sometimes used for agriculture, but definitely not kind of agroecological practices, that or were just not used at all. So they decided to use these spaces to do agroecological kind of projects for multiple purposes. One, to improve the inmates' nutrition and to protect the environment, but two, also to make it one of the reintegration income generating activities that these young people who are in these detention centers are participating in. Because one of the things that they have to do while they're there is do some sort of activity that when they leave the center, they can potentially have a project that it can be income generating in the future. So now they've, as a health organization that was there from the beginning to really provide health services, has created this project because they see the link with the future of these young people and their nutrition. So just to give examples of how adaptation and resilience means something different for all these organizations, and through this roadmap we can and these collective cycles, we allow them and help them kind of just bring these ideas that they already have come to life. So this is on the collective cycle, and what the accelerator has done, and these will be just my few last slides, is bring all this experience together and create a playbook that is today in the phase of being finalized into the final version. This is a consultative version that we shared with our partners during a regional event we had in December. And the idea is to share kind of what is the summary of our lessons that we learned in a collective cycle. What are our lessons learned? What did our partners learn? You know, and the scope of it is really these first 5 national NGOs and what they taught us and what they learned themselves, and that can be used for other NGOs in West Africa that want to do the same, or for international NGOs and their offices and missions in this sector, in this world. And the idea is to really talk about our lessons. I think here I'll just, our lessons, the methodology that we used, what are the principles that these organizations share, the themes, the solutions and actions that come from it, examples of what we call integrated approach, which is one of the example Alexandre gave, some case studies from our partners. So I mentioned 2, Alerte Santé and SOS Médecins in Chad and Mali, but all of them have very specific flagship projects that can inspire other organizations. We talk about, you know, what did they put in place to make this happen in the organization? We talk about financial resources. And then lastly, we have a lot of different mappings and inventory of solutions that we add in the annex to help, so that you don't have to be part of this collective cycle necessarily to do this work. Other organizations could also potentially start this up with the help of this guide, which we'll publish very soon in its final version. And that's it for my presentation. I'm gonna stop sharing my screen.
Thank you very much, Zaninka. I'm really excited to see that your stakeholders or your actors are working around water, sanitation, and hygiene. They are working around education, youth empowerment, women, conflict, and also in prisons. I have a special love for improving health in prisons, so I'm always very excited to hear about prisons. And I also like the fact that the model is really clear, and you have also documented it so well that even organizations that don't get the opportunity to be part of the collaboration, it's a model that they can easily understand and implement. And you are able to co-create the roadmaps, adapt the roadmaps, introduce measurements to see how you are improving. And then you are also doing reinforcement of concrete projects. And we saw very impactful examples of the concrete projects that you have implemented. And then you are also supporting stakeholders to have access to finances. And also, very importantly, you are giving them access to knowledge sharing, and also giving them the opportunity to share their experiences. These are very, very valuable resources that stakeholders can benefit from. And the fact that you are documenting appropriately, mapping out stakeholders and interventions very well, and these are going to be published in the roadmaps that you'll be launching very soon. This is very exciting. Thank you so much, Saninka. We will come back to the questions session for panelists. Thank you so much. So, colleagues, I would like to invite Hannah from the Planetary Health Alliance, the global team. Hannah is head of partnerships. And so since we are talking about partnerships, it's very exciting to have Hannah on the call. Hannah has a flu. She's not feeling very well, so she has asked that she would turn off her camera, and that is okay. So please pardon us. Hannah, please, over to you.
Hi, Mary, and I will turn on my camera by excuse everyone.
Oh, okay, great.
Ill right now.
Wonderful.
But as Mary explained, my name is Hannah Turley, and I'm a partnership coordinator at the Planetary Health Alliance. And Mary has asked me to just give a quick overview of some of the takeaways from these presentations. And so I think what I really loved listening to was kind of this story that was told throughout the three presentations, where we started with Paul really talking about this local context and what the Planetary Health West Africa Hub is working towards and working on, and how they're empowering youth and local organizers because they are from this local context and understand it. Then we moved on to Alexander and talking about the Climate Action Accelerator and some of the specific projects they are working on within West Africa, and those clear examples of the climate resilience and the integrated into health systems. And then finally, an example of how using those projects and the toolkits that you can use to make sure that these projects and the examples that you're learning are really working towards and can be implemented in other areas, and kind of the lessons learned, and how, for me, it was a really overarching theme of the power of partnerships, the powers of empowering the local communities and ensuring that local communities have their voices. And then this idea that we all are in this challenge together and we all need to work together, and that examples and lessons learned can be taken throughout the different areas. I think that was my really quick reflections on these presentations, and I welcome any questions, and I want to applaud and thank the panelists for the presentations this morning and this afternoon. And I'm, excuse me.
Thank you very much, Hannah. We are very grateful for your time. And although you are not feeling so well, you have still been able to mobilize the rest of the energy that you have today. We are grateful. And please get well soon. Get some hot tea today, or hot pepper soup, as the Nigerians say, and get well soon. So, colleagues, thank you for staying on with us. We have come to the end of the presentations and the reflections from Hannah, and we are happy to take a few questions because we are almost at the top of the hour. We are happy to take a few questions, and then I'll give the opportunity to our panelists to say their closing remarks. So if you would like to speak, please raise your hands or just unmute and ask your question, please. We will take 3 questions from the beginning. Yeah.
Mary, there is a question in the chat. I don't believe participants can unmute because we're on a webinar.
Let me intervene on this. I think when people raise their hand, the co-host, we can allow them to talk. So, but true,
Yes.
there is a first question in the Q&A that maybe you can read, Mari.
Okay, I'm looking in the Q&A and let me see. Okay. I don't know why I'm not accessing the Q&A. Okay, sorry, it's my machine. I can see it now. Okay, so we have a question from Casimir Joko, and he wants to know, do you have to extend this program to other areas, countries such as DRC? Okay, so this is to both Climate Action Accelerator and the Planetary Health Alliance. So please, panelists, take note of the question. The second one, great. This is from Alberto Janowski. He says, great presentations and a lot of information to digest. Congratulations. Any plans to go beyond West Africa? I, from Latin America, a researcher, teacher, and practitioners. Okay, wonderful. So we have two questions. Whilst we wait for the other questions, I would like to come to the panelists. So tell us whether you have plans of bringing the interventions to DRC Congo. And also, do we, the two organizations, do we have plans of going beyond West Africa? Yeah. So which of panelists would like to go first, please? Please feel free to unmute and speak. Zaninka, do you want to go? I see you smiling, so maybe.
I can just maybe go first quickly and then.
Yeah, I think that question is hard.
It's okay, it's for the collective cycle. So in general, and I think Alexandre, you can add a little bit from the health program. In general, the accelerator has thought a lot about expanding in general in Africa, especially as it relates to how organically, when we start talking about implementation for humanitarian aid organizations, we started to see kind of having to do more work in the field, and these collective cycles was one of them. The pilots that Exxon talked were one of them. So last year we did a feasibility and opportunity study to kind of understand better what would it mean for the Climate Action Accelerator to exist more physically and fully in Africa. And we did you can't treat Africa as a whole. So we did focus a lot on West Africa, where we already had some projects, but we did look a little bit at Kenya, at Rwanda. But kind of as a first idea, and looking at some partners, speaking to some people, understanding what the need is, like where would our value added be, or how transferable is what we're talking about to other regions. What we see is that it is relevant. I think there is some need. I know Alexandre can talk a little bit about our other projects in Southern Africa and other places. So we're still kind of at this phase of piloting in different places, accepting a lot of different partnership requests and meeting different partners from different regions. And I think over time, especially with funding, we'll be able to expand this and see in other regions. So I would say the interest is there, both from our side and from different organizations that contact us. It's really more about how quickly can you kind of accelerate into different regions, especially doing it I'd say strategically, and also really making sure what the value added would be, what would be the partner. So we're really making sure to get that kind of piece right, especially through these collective cycles. But I know that the pilot projects on which Alexandre worked allow for this kind of quicker testing and piloting in different regions. So I'll let Alexandre, I think, speak on it as well.
Okay, thank you so much, Zaninka. So Alexandre, whilst you add your comments to the first question that Zaninka has just answered, I want to add another question for you to answer after that. So Eunice Boache is saying, I think I missed it, but I would love to know how to assess the toolkit and also the playbook when it's finalized. You have done really great work, and I would love to learn more. So I guess, Eunice, came in a few minutes late. So if Alexandra, if you can also throw light on how to access the toolkit. Thank you.
Okay, thank you very much. I will start from that. I think my colleagues can share it again in the chat, and probably Zaninka, I think there is a page with the consultative version of the playbook that you can share as well. So done. Thank you very much. About the extension to other countries, so I'll start by the question specifically on Latin America. So our NGO is 4 years old. We started with a HQ here in Geneva. Now we have a presence in Dakar in West Africa and soon in South Asia because we have this project in Bangladesh and we have a colleague working in South Asia. So for the moment, we focus on Africa and South first and South Asia second. But maybe in the near future, we will look at the Latin America, but that's not a priority for the moment. Also because we work in English and French, and working in Latin America will mean adding another language, and we're not there yet. But we're happy to explore that in the coming years. And so the extension to other African countries to complement what Zaninka said. So at the moment, to repeat, we have 3 pilots, one in Senegal, one in Chad, one in South Africa. Already in the pipeline with the NGO Alima, we have a few more, for example, in Niger or especially in Cameroon. So we might start a new one in Cameroon this year. And we're working with other partners to develop some project proposals. So also, if people around these screens have ideas of projects in hospitals or primary health care, or we even starting to develop our offer on surgery, anesthesia, please reach out and we can look together if we could develop some projects in the next month or years. And a reflection on the extension. So what we see now is that South Africa, the country, is becoming a priority for us because we have a pilot there, plus this capacity development project that I presented with the toolbox and the operational methodology to work with local health authorities. And yeah, with these 2 levels, either other health facilities or working with health authorities, we will soon cover other countries. And I would say that, yeah, maybe the DRC, to finish on what was taken as an example, could be a country where we intervene as well. Thank you.
Thank you so much, Alexandre. So I think I would now also add one question to the first question for Paul to address. The first presenter mentioned about the campus ambassadors, a tool that seems more efficient and sustainable. I'm wondering how they set up this team. I would love to copy this for Uganda. So Paul, can you answer this question, add it to the first one, which talks about if you have plans to extend programs to the DRC?
Thank you very much, Dr. Mary. Maybe I can answer the first question or the second question. Fortunately, DRC Congo is from the East Africa. So I think our neighboring hub can take care of that. You know, because Congo is from the Central Africa, so might not be able to except if we're able to get some you know, collaboration with the Central Africa team. So as maybe I can use this opportunity to talk about the campus ambassador team. Because I can see that quite a number of people really want to hear from us regarding the Planetary Health Campus ambassadors. Who are they? They are campus ambassadors who are very motivated, and they are from the university. They are students who are trained and empowered to act as local champions on planetary health within their institutions and communities. So they are regarded as the bridge between global planetary health goals and grassroots action on campuses. And why do we have them over there. They have them because we believe so much that youth-led, peer-driven. We have students who learn from their peers, and they tend to come together to inspire one another, to become role models, and then they form collaboration to create awareness on planetary health. And the reason why we are doing this because it is low cost and high impact, and it is institutional driven. So that is why we have quite a lot of success rates when it comes to, our campus ambassador, planetary health champions. So for the setup, I don't know, probably might need to meet with us on the best way to set campus ambassador program. Because I only have just a few things to talk about on how to set it up. Number one is you need to identify your target institution. For instance, if you're a student in the university, you can use that as your base. You start, with your university, you try to inform some of the stakeholders in the university and tell them what you plan to do, because we have seen many students who started like that. And from time to time, we try to encourage them. From time to time, we try to educate them on the best way to go about that. So, and by the time you do that, you can easily call for applications. You can tell people, oh, if you're interested in joining us in the Planetary Health Alliance movement, kindly join our club. And then from there, you can select those people, and then you design an orientation program for them. And in the orientation program, you talk about what planetary health is all about. You talk about their roles as ambassadors. You also talk about the tools for organizing event advocacy. And of course, you can also provide the starter toolkit that we have. I think we have them on our website, that you can make use of. I think Hannah would be sharing that link with us so that you can take a look at some of the starter toolkit. It has a social media template, it has event ideas, it has a way of reporting templates, it has some posters that you can use, just some digital resources that you can make use of. Then the next step is just to try as much as possible to be part of the mentorship platform, where you can, meet with us so that in one way or the other, we can mentor you and tell you what to do and what you need to do. We can share our progress, we can troubleshoot some of the challenges you're having, and we can also, engage you to promote peer-to-peer learning. And at the end, we can celebrate successes together. So thank you very much.
Thank you very much, Paul. I was going to say that the Planetary Health Alliance has 10 hubs, as Paul mentioned, and West Africa is just one of the hubs. So in any country that you are, there's a hub for you. You just have to visit our website and then click on your hub, and then there's a button where you can join the hub. So please go to our website for more information. And I think Paul has promoted the Campus Ambassador Program so well. And I was going to say the best way to replicate Campus Ambassador Program in your country is actually for you to become a Campus Ambassador first. So just follow the Planetary Health Alliance on LinkedIn, on Twitter, and then once the Campus Ambassador program is launched every year, you just apply. And I remember the year that I was a campus ambassador, I think there were 121 campus ambassadors from across the world. So it's a good opportunity to grow your network, find colleagues who are working around planetary health, and then also be able to understand the concept of planetary health. So become a campus ambassador, and then you can replicate the program in your country. Wonderful. So we have one final question, which I would give to all panelists. And because of time, I think we have 10 minutes more or 20 minutes. So because of time, I'll suggest to panelists to answer the questions and then add their closing comments so that we can stay within time. So the question is from Raymond Ryoka, and he says, thank you for great presentations. This is Dr. Raymond from Uganda. My question is, how are you promoting sustainable financing financing for health sector in your programs, praying that Climate Action Accelerator reaches Eastern Africa. Okay, here in East Africa, we have Planetary Health Alliance, but it still needs support. Okay, so thanks. From Raymond. Okay, wonderful. So we want panelists to talk about sustainable financing. And I think this is a very extremely important question, especially within the current context where there's a lot of cut on aid to Africa. I saw a publication from the Africa CDC that said that I think by what year did they quote? I think by 2050, the aid to Africa would have cut by 75%. And that is a lot, which means countries by themselves have to do domestic funding a lot. And that also means efficient use of resources. And so I think this is a very, very important question in the current context. So I'm happy to give the question to all three panelists. Tell us what your thoughts are on sustainable funding, and then add your closing comments. Please be mindful of the time as you answer the questions. Thank you. Who is going first, please? Yeah.
I can go. If you...
Alexandre, okay, please.
So yeah, first I'll reply a bit on the comments on the regional hubs of the Planetary Health Alliance, and we know Raymond. We actually met today with Raymond. So one thing with the regional hubs is that they are all about 5 years old, and that's why they're starting and they need more support to grow. So it's a very new initiative, and I hope they grow more. And I think that's the focus of webinars and partnerships like today. Yes, I'm taking this question on sustainable finance because, so yes, we are working on sustainable finance or with actors of sustainable finance. There are two key groups that I can mention, and there are other things that I don't know, but with the Alliance on Transformative Action in Climate and Health, of the WHO, there is a working group on financing climate resilient and environmentally sustainable health systems. And there, I can share you the link after of the partners, but in the list of partners, you have the Asian Infrastructure Investment Bank, a Norwegian Agency for Development, the World Bank Group. I know the French Development Agency and the European Investment Bank are working on this agenda as well. So specifically on health, there are these funders. There is also philanthropies such as the Rockefeller Foundation, Wellcome Trust, and a few others that I don't have like this on top of my head. So these are the actors working specifically on finance in healthcare on the climate resilience agenda. And at the end of February, I was in South Africa with our partner, the French Development Agency, attending one summit, which is called the Finance in Common Summit for the year 2025. And Finance in Common is an initiative carried by a few development banks. I think this one was supported by the Southern Africa Development Bank and the French Development Agency, and there was a third one that I forget, but I can share also the name of the summit online. So this platform or consortium of public development banks is uniting more than 500 public development banks in the world. They represent, I think, if I remember well, 12% of annual world investments, and that the amount is about 23 trillions of dollars. And they're trying to look at climate finance and other sustainable finance. And in the last summit, they were very interested about looking at how they can invest in what they call social infrastructure. And under the label social infrastructure, you can put anything regarding social assistance work or education or health. And with our partners, the University of Stellenbosch in South Africa, we could present one of our pilots in a working group. So to conclude, Raymond, the answer is yes, there are some actors working on that. And the question of financing climate action in the health sector or integrating health in the climate agenda is taking up with these different public development banks.
Okay, thank you so much, Alexandre. I think the solution to sustainable funding includes partnerships. And Alexandre has mapped out the stakeholders who we need to talk to advance the conversation. So this is really very helpful. Thank you so much, Alexandre. Did you add your closing remarks already? Or, yeah, final thing, what do you want to say as we come to a close?
Okay, yeah, I forgot about that. Thank you for the reminder, Mary. No, my closing remark is that so we think that in this world where the facts are known, there is some policy in place. In a lot of places, there is political will. We think that somewhere to invest is on accelerating action, as our name is saying, and really trying to work together concretely at the operational level to know where to start, what to start with the few examples I gave you today. So if you're interested in this agenda of acting on climate change and other planetary boundaries in the health sector, please follow us and please reach out. I think there is a lot to do, and I was very happy to have this discussion with Planetary Health colleagues from West Africa. Thank you very much.
Thank you so much, Alexandre. I think this is really important for the team, from knowledge to action. We know a lot. We have so many facts, so much research, political will. So we have so much knowledge on climate change and health. And now we have to act. We need to implement on the ground, implementation, reach to the communities. So that is very important. Thank you so much. Paul, can we have you answer the question on sustainable funding and then your closing remarks, please?
Thank you very much, Dr. Mary. And I must appreciate what Alex just talked about regarding strong partnerships. For us at Planetary Health Alliance, West Africa, we rely so much on our mother hub because currently, we don't have direct funding moment. However, we have sustained our activities through resourcefulness, through strong partnerships, and a kind of a shared commitment to impact. We usually leverage the strengths and the networks of members, many of whom are affiliated with universities. Some of them are in the non-governmental organizations, public health institutions, to co-host events, to share their research and engage communities with minimal financial input. So this collaborative model allows us to, pool resources, to volunteer expertise, and of course, institutional support to keep the momentum alive. And going forward, we are actively exploring partnerships with local and international organizations. We've had time where we had to sit down to write some grants. Just the last time we had to, write a grant, in order just to have something with us, to work with. So, like I said, we are partnering with local and international organizations. We are, soliciting for grant opportunities, and of course, donor collaborations as well. So our strategy is just to demonstrate value through our ongoing work, so that funders and partners can see the potential, for scale. They can see potentials for sustainability. They can see potential for long-term impact when they invest in locally driven, regionally coordinated planetary health initiatives. So, and that is what we have currently, and we know that very soon, these things will change for us at the region. So, for my final remarks, we all know that real change happens when ideas become collaborations and strategies become shared solutions. That's why we are here as a region to collaborate, to partner with every organization so that we can, do more in our region, so that we can advocate more, so that we can reach as many youths as possible, so that we can develop policies. And I believe so much that there's room for everyone in this mission. So if you are very passionate about the Planetary Health Alliance, especially the vision and the mission of region, we want to use this opportunity to, encourage you so that we can move from knowledge to action together. You can reach out to us, you can connect with us so that we can co-create the future of planetary health in West Africa. And I want to say thank you once again for your time, your passion, and of course, your commitment to support us. Thank you.
Okay, thank you so much. Thank you, Paul. I think you have emphasized the need for us to work through member organizations. I think West Africa currently has more than 50 member organizations, and to ensure sustainable financing, efficient use of resources needs us to work through member organizations who are on the ground, right? So from knowledge to action, we need to get closer to the communities. Thank you so much. Zaninka, I'm coming back to you. Your thoughts on sustainable financing and then your closing remarks, please.
Closing remarks. Okay, I was going to say so much pressure going after those two, but on sustainable financing, I think I don't know if I have anything to add. I think what we try to do with our partners is to share as much as possible, to share anything we find, to help them when they need any help to kind of apply for funds. And then if we can find funding where we can kind of funnel some support through for implementing specific concrete actions, we try to do so. It's not always possible, but it's really about creating those opportunities as much as possible and raising the voice of those concrete actions, as I was saying, because sometimes they're doing so much and it's just not captured. So trying to do that. And then I think just for closing remarks, I think I wanted to say that I think it's really important for all actors and all organizations to continue piloting these different projects that they see that are relevant. I think sometimes just the word climate is not written on it, or climate resilience is not written on it, but it is that they're doing. And I think it's this accumulation of projects and pilots and piloting things that work, that don't work, that increases the knowledge of actors and of sectors. And we've seen that all the organizations that we work with already know so much, already started so much. So I think kind of breaking as well this I think false idea that African organizations or actors are not doing this or are not interested or it's not their responsibility. I think it's been really refreshing to see that is not the case. So I think continue to do that. And then, I mean, us as like Alexandre was saying, as a small young NGO, we will keep doing our best to kind of enter this space and really find where our value added is. And I do hope, as Raymond said, that we increase our reach in different regions and partner with different organizations to just, I think, accelerate, as our name says, already what organizations are doing. So yeah, it was really great to be here to learn about all these different things. And yeah, I think that's it for me.
Thank you so much, Zaninka. So I think I like what you said about sharing the data, sharing the evidence, sharing the sources of resources, especially financial resources, and then also sharing the competencies through capacity building. For example, you talked about documentation, which is really true. If it's not written, it's not done. But so much is being done by African organizations, but the documentation is where we need to support organizations to document what they implement and then the lessons that they learn that other organizations can also learn from. So this is wonderful. And I liked what you said about piloting. Let's continue to pilot. That generates the evidence. And then when we find the evidence, we share it with our stakeholders so that improves the partnership. So thank you so much. So distinguished ladies and gentlemen, we have come to the end of a very intriguing, exciting, and knowledge-packed webinar, which is going into action. Thank you so much, Climate Action Accelerator. Thank you so much, Planetary Health Alliance, the global team, and the West Africa Hub. I know that the Climate Action Accelerator, our colleagues from Climate Action Accelerator would also be having a webinar with our colleagues from the East Africa Hub. So look forward to receive the details of the meeting and share it with your networks within East Africa to join. I wanted to say that as we were asking, how do we go into other countries? If you go to our website at the West Africa Hub, you would see that we are currently recruiting country representatives. So please apply to be a country representative. That is an opportunity for you to operationalize planetary health within your country, reach out and grow your network and advance the work of planetary health within your country. So I would like to, on behalf of our two organizations that are co-hosting the webinar, thank you so much for your time. And we look forward to seeing you in our next webinar. Thank you so much, panelists. Thank you, Sonia, and the administrative team who have done all the hard work behind the scene to make sure that we have had a very seamless webinar, no technical hitches. Trust me, if there were hitches, I'll just hold my head because I have no idea on IT and WhatsApp. So thank you, we really appreciate you. And have a lovely morning, evening, afternoon, which part of the world that you are. Thank you so much and see you in our next webinar. Bye-bye.
Thank you. Thank you for the great moderation, Mary.
Yeah.
Oh, it's a pleasure, Sanyoka. It's a pleasure.
Thank you, Dr. Mary. Thank you,
Bye,
everyone.
everyone. Thank you.
Roger, thank you. Yeah.
Bye-bye.